A stroke is injury to the brain that happens either because of interruption of blood flow to the brain or because a blood vessel in the brain ruptures, leading to bleeding into or around the brain. What happens is when you lose the blood flow to the brain becomes starved of oxygen and nutrients, and the brain cells begin to die. Sometimes we can reverse the effects of stroke if we can get rid of the blood clot or stop the bleeding quickly. We can limit the amount of damage that occurs. So the faster that we can start our treatment, the more likely we are to help a person recover from the stroke. So strokes can cause a lot of different symptoms because, of course, everything in our body is run by our brain. But some of the more common symptoms are weakness on one side of the body, loss of vision, particularly on one side or in one eye, loss of ability to either speak or understand speech, changes in sensation or coordination, dizziness, double vision, and various things like that. But by far the most common problems are weakness on one side of the body and loss of the ability to speak or understand speech. So the risk factors for stroke include things like age, smoking history, and family history. So of those three things, smoking is the one thing you can do something about. So if you're a smoker, please quit today. Family history and age are not something that we can fix, but fortunately there are other risk factors that we can modify. These include high blood pressure, for which it's important to exercise regularly and try to keep your weight down and try to limit your intake of salt. Having high cholesterol is also a risk factor. And there again, exercise, keeping your weight down, watching how you eat, trying to eat a good balanced diet without too much fat and without too much carbohydrate is a good idea. And then if your cholesterol levels are still high, talking to your doctor about taking the appropriate medications. Same goes for high blood pressure. If your blood pressure is high despite adjusting your lifestyle, talk to your physician about being on medications to lower your blood pressure. And finally, modifying your risk factor for diabetes is very important for limiting your risk for stroke. So if you're overweight or have high blood sugars, it's really, really important to try to lose weight through a diet and exercise, and if necessary, take medications to keep your blood sugars down. So it turns out that smoking very, very dramatically accelerates the rate of hardening of the arteries, called atherosclerotic disease. So people who smoke have hardening of the arteries that happens much, much faster than people who don't smoke. And in fact, it's so pronounced that risk alone, continuing to smoke, outweighs all of the benefits, all of the medications that we use to try to help people avoid strokes and heart attacks. So you must quit smoking if you are a smoker.